So we did a study by comparing different sources, what we call matrices, in the body, venous blood, capillary blood, urine, and saliva, to find different microorganisms, so-called crypto-infections, because it's not only Borrelia. And we tried to use biofilm breakers, serrapeptase, to see if it could improve the results. So it's a Pathotique 2 study. Here you have all the names of the my co-investigators. Most of them are physicians, GPs, and some specialists, and also biologists working in the lab, directed by Professor Michel Franck, who is a prof of veterinary medicine in Lyon, and who is director of the adnuclease lab, and he performed all the PCR tests. This study was funded by the group Ramsay Santé with Dr. Mary Mass in a medical clinic in Bourg-en-Bresse, France, and by Bionops, who provided serrapeptase. So, as you know, PCR, often the results are not evident because there are various techniques, often homemade. We are not in the stage of universally recognized PCRs made by the industrial companies. There are various results, various matrices, frequent low sensitivity. We need to compare different studies to standardize. And it's important, I think, to collaborate between human labs and vet labs, because I think they are in advance. So in this study, we realized a PCR to search 18 bacteria, 1 fungus, Candida albicans, 2 parasites, Babesia, Theileria, and 13 viruses. The patient population was what we call in the English language literature the PTLDS syndrome, post-treatment Lyme disease syndrome, but in fact, these patients are, for I think an important proportion of them are not really post-Lyme disease syndromes. We call them in France persistent polymorphic syndromes after a possible tick bite. And the patient should have not been treated with anti-infective drugs for at least 2 months. PCR we realized with 2 samples for each matrix at day 0 and day 3 on venous blood, capillary blood, urine, saliva. And after the first sample, people took serrapeptase, a biofilm breaker, during 3 days to see if by chance we could improve the results of the second sample. So the adnuclease lab performed the study. Here you have some information about the technical points. So we took venous blood, capillary blood, urine, and so on. So here you have technical points. The primers and probes came from reference laboratories or from the literature. Here you have the technical aspects about the buffer, the technology, and so on. And the PCR program, initial denaturation step for 5 minutes at 95 degrees and 42 cycles, and quantification with serial dilution of the positive control. Here you have the test used for Borrelia. We use Borrelia bulbiflorens sensulato kit, and also Borrelia afzelii and Borrelia garinii kits. These last 2 kits are more sensitive by the sensulato kit. Just a word about the difference between Babesia and Theileria, because before these 2 species were called as Babesia, but in 2006, Babesia microti was renamed Theileria microti, thanks to sequences and the comparison of their genomes. And in our study, Theileria microti was detected with Theileria primers, not with Babesia primers. And for Babesia primers, Probably they correspond to species of Babesia not yet identified in humans. Here you have the different species often known by veterinaries, but we don't know in human medicine. But it was not possible in this study to differentiate all these species. Here you have some sequences. So we studied 105 patients. PCR was positive for at least one microbe in the venous blood in 19% of the cases. And you see here I think the approval to use capillary blood. Probably capillaries are filters in the bloodstream and can retain some microorganisms in their nets. So more than 50% positive results. Urine, high rate also of positive results in saliva. Last year, and we are going to publish this study, there was a Pathotique 1 study. If you compare the two studies, we see for venous blood, it was approximately the same rate of positive results, 17%, 19%. Capillary blood seems more effective for some microorganism. Nearly half of the patients have a positive results, and urine and saliva may be also interesting. Here you have all the bugs that we could identify. A first group of 3 microorganisms found with high frequency, more than 29%. Mycoplasma was found in the great majority of the patients. I'm not sure that they are all pathogenic, of course, but that's a fact. We find a lot of mycoplasma. Candida, I don't know exactly the meaning of that, but in 1/3 of the patients, and Rickettsia species in nearly 30% of the patients. After that, we have a second group between 6% and 12% with Bartonella around 10 to 11%. Borrelia garinii, 6.7%, which seems to be the first species isolated in France, and then Ehrlichia, chlamydia around 7%. Now we have a microorganism that we found with a low frequency, less than 2%, Brucella, Bartonella, Quintana, and here you see that the other Borrelia species other than Garinii were rarely found, less than 2%. That's a surprise, but when I see that, I think that when we call all these patients chronic Lyme disease, I think that the Borrelia represents only the tip of the iceberg, and there are much more different bacteria or parasites involved. Coxiella burnetii in 1% and Ehrlichia microrensis 1%. And in this series, we didn't find Borrelia miyamotoi, Francisella, or Anaplasma. If we compare with the study we published this year about miyamotoi, we were surprised to not find Borrelia miyamotoi cases in this study, but when we did a statistical analysis, because the study on miyamotoi was done on 824 patients, this study was done on only 100 patients. In fact, the difference was not significant. Our great surprise was to find many cases of Theileria infection, at least positive result for PCR. You see nearly 30% of the cases were positive for Theileria, and Babesia it was only 3%. So you have 10 times more Theileria than Babesia. And I remember before starting the study, I asked Franck to add Theileria research in his PCR kits, because I read some papers a few years ago showing that Theileria could induce a cancer process in human cells. And the vets know very well Theileria. They are very frequent in animals, especially horses, but they have never been studied previously in humans. We looked for some viruses, so we found a small amount of CMV, HHV6, chikungunya, Zika, West Nile, and for the other viruses, in this population of 105 patients, we didn't find more viruses. Now, if we look at the localization of the different microorganisms, you can see that for mycoplasma, they are especially frequent urine, saliva, but sorry, but I can't see part of my slides. If I can change. Oh, okay, sorry. Candida, I didn't expect at the beginning that we could find so many Candida positive tests. I don't know if it's reliable with clinical conditions. And rickettsia was as frequent in urine and saliva. For the population, the group of moderate frequency microorganisms, you see that Bartonella, either species or ancillary, could be found in the different matrices, Borrelia garinii, Ehrlichia, and Chlamydia. I'm sorry, but I cannot see part of my slides, so I try to change now. Oh, sorry. I don't know how to see my slides. Oh, that's better. Okay. Now I see better. Here you have the other bugs that we found with low frequency. So some of them in urine and saliva. For Theileria, you can see that most of them are found in capillary blood and saliva. That's important because I think in capillary blood, it's not a contamination. They are really there. It's not already known in humans. I think it should be further studied because it may have some importance in some clinical conditions. We have to study that. And they are much more frequent than Babesia. Here, some cases of viruses. Most of the viruses were found in urine, but that is already known after where we had the big chikungunya epidemics in the world. In some cases, the virus could be found in the urine, also for Zika. Now, what is the interest of the second sample after serrapeptase? You can see that in some patients, the second sample was positive, while the first sample was negative. 9 cases for venous blood, 16 cases for capillary blood, 19 for urine, and 26 for saliva. So probably, as for the research of Mycobacterium tuberculosis in the sputum, it could be interesting to do 2 or maybe, I don't know, 3 samples to increase the results. Here you see that some microbes are only found in 1 matrix, 7 only in the venous blood, 14 only in the capillary blood. That means if we only search in the venous blood, we couldn't see them. Some only in urine, some only in saliva. It's a great amount of them. So in venous blood, some cases of Bartonella, Rickettsia, Babesia, Theileria was only found in venous blood, but some cases were only found in capillary blood, especially Candida and Theileria. And he only found in urine. You can see Rickettsia, Bartonella and Celi, and some others. Only found in saliva, Rickettsia, Bartonella, and Candida were at the top. So what is the meaning of the salivary infection? Is it external colonization or secretion from salivary glands? I think this should be studied more because there is a tropism of some microorganisms of salivary glands. And we know the role of saliva for transmission of some infections, for example, rabies or EBV. And salivary glands are holomerocrine. So the secretion needs disruption of the apex of the acini cells. Thus, these acini cells must multiply rapidly. This could enhance the tropism of some microorganisms. So if we look at main bugs we found, for Mycoplasma, which was found at a very high level, it was mainly found in saliva. Is it just an asymptomatic carriage or real infection? We found it in urine, could be contamination from the genital tract. But we found it on a systemic point of view in the capillary blood. Probably this is more important. For Candida, we found more Candida in capillary blood. For saliva, I'm not sure it's really infection, it may be probable colonization. In urine also, we cannot eliminate possible contamination during urine collection. Bartonella, we found it more frequently in capillary blood, so that's interesting. Maybe saliva could be a source of transmission. We know a transmission of Bartonella after an animal bite, after animal scratch. So it could be a source of transmission, but we didn't really study in humans. What we see here is for Borrelia, there is a very low sensitivity of all these tests. So when we say that a patient has a so-called chronic Lyme disease and we only focus on Borrelia, I think that we don't find positive results in many cases. Ehrlichia, we saw the interest of capillary blood, and for Theileria also, a great superiority of capillary blood combined with venous blood. And here we saw especially the interest of the biofilm breaker serrapeptase. In conclusion, for these chronic syndromes, the interest of PCRs to search a wide range of microorganisms, take samples from several matrices. It seems to be very important. Venous blood, capillary blood, urine, saliva. Take samples twice at least, and maybe the interest of serrapeptase should be confirmed. And tomorrow, I'll show you that this accurate microbial diagnosis may allow correlations with some signs and symptoms. So thank you.